Everybody, this is our first committee meeting to talk about workforce challenges related to autism. So I'm Lynn Rickey. I'm a parent and a provider, and I think certainly Julie knows me and Tara knows me. Mary Beth, maybe we'll just do quick introductions. I think there's only a couple of us on the line.
Yes, sorry, I'm having problems with my Zoom. But Mary Beth Miller, I'm staff training with the Office of Early Childhood.
Mary Beth, I'm sorry, your audio is impossible to hear. Is it possible that
but I'm also the parent of a child with autism. So, thank you.
Thank you. Mary Beth, just if you don't mind, maybe just, I'm not sure, there's some competition with your audio, so you're very, very crackly, but thanks for joining us. And maybe I'm not sure if there's competition, if you have it on your phone and another device, sometimes turning off one will help, but just to make sure we hear whatever you have to add to it. So thanks for joining us. And Julie?
Hello, I'm Julie. I'm a clinical psychologist. I work at the
Can you
Child
hear me?
Studies Center.
Oh, that's much better. Yay.
Oh, but then she disappeared. She said, "Can you hear me?" And then she just vanished. Hopefully she'll rejoin.
Yeah.
So I work at the Yale Child Stay Center. I'm the associate director there of the Developmental Disabilities Clinic. I kind of joined this subcommittee because I'm very interested in education and training. I'm actually in July stepping into a new role at the Child Study Center of Vice Chair of Education and Professional Development. So this is
perfect. Yeah,
good synergy and just a topic that's near and dear to my heart. I also do a lot of training of our psychology fellows, practicum students, and post-grad fellows at the Child Study Center. So
sweet. Great.
Congratulations.
Yeah, that's a big job. That's awesome. Julie, I don't know if I ever told you that literally it feels like 100 years ago. Do you remember the name Armin Thies?
Yeah.
I actually worked on Saturday mornings doing testings at Yale Child Study Center, literally back in the late 80s.
Oh, wow.
So yeah, very long time
and then
ago.
We have another connection because Lauren Herlihy, who is with you now, was my very first mentee at Yale. She was the first person I hired and worked closely with her.
Well,
so yeah.
Thank you for doing that, because she's done really well. And she's actually somebody that I thought might be helpful to be sort of a member of this committee, even though she's not on the council, because she does a lot of our development work of folks. So great.
That would be fantastic.
Great. Tara, you want to jump in?
Sure. Tara Vines, OPM, lead, what's the official title? Lead planning analyst of autism services for the state. So I'm really excited to be here. This was doing training and education was a big part of my role when I worked in Pennsylvania. So definitely interested in continuing that. And as you know, we're looking from a statewide perspective. I really would like to see and learn more about what's currently out there, and then how we can assist with, helping to build the workforce and anything that we can do here at OPM to move the needle on that, especially for autism services, since we have a lot of wait lists and all of that, which you guys are very familiar with. So very excited about this work group.
Great. So, Tara, do you mind just maybe to sort of set a foundation for us? Can you let us know, and I think you did with me, and I apologize, I don't have it printed off and in front of me, who will make up the committee at this point, who has expressed an interest, so we know who our working group will be going forward?
Yeah, sure. I know Carrie Sassu had expressed interest. Also, Brian Klumkowitz from CSDE, and Yana,
Yep, okay.
who's on the council, and then also Melissa, is it Gagne?
Yes. Gagne, I think is how she says
Gagne,
it.
okay.
Yes.
So those were all the people who responded to the initial survey.
Okay.
Besides, and then Mary Beth, oh, I don't know if she's been able to, here she is. I'm gonna see if,
Great.
and she's from OEC on the
Okay.
council.
Okay.
She's the OEC representative.
Okay. Let's see, hopefully we can hear. Mary Beth, can you say hello again, just so we can let you know how your audio is sounding? Okay.
Oh, there we go. Okay, I'm sorry. Oh my goodness, today. Hi, I am Mary Beth Miller. If I can get my Zoom to work today, I am staff
Perfect.
attorney. There we go.
Much better.
Here it is.
Much better.
Technology, right? I'm a staff attorney at the Office of Early Childhood, so I'm here in that capacity. But I am also the parent of a child with autism, so I'm happy to be a part of this.
Great. Thanks for joining us. I'm glad that worked better.
Yes.
So today I think is just sort of level setting and maybe doing some future planning, but just for the committee to think about what our mission and vision is. I think the concept of workforce development for autism is it's like boiling the ocean, right? So just thinking about what is it that we actually hope to accomplish. And I don't think we have a specific time frame. And I don't know that we've actually established a cadence for the meetings either. Tara, I don't know if you have any thoughts about that, but I think that's, having been on the council for, I don't know, 12 years or something like that, I think one of the challenges has always been kind of keeping the momentum going, because we all have, day jobs and night jobs. And just trying to keeping the momentum going has, I think, been the most challenging piece of the work that we're doing. I think despite that, we definitely have made progress, but I think that's challenging. So I think talking about what the cadence of the meeting is, and then really what you guys' thoughts are in terms of what you see as a mission and vision for this group.
I'll just start quickly and wanted to add, as OPM has taken over the role of, the administrative role for the council, that's something that I'm definitely pushing for, is just to see some more work and outcomes happen as a result of the council, and not, I feel like from what I've looked back on, a lot of it's reporting out more than it is actual work that's been done. So I'm really pushing for more outcomes, and I'm here to help keep that momentum going. So that's part of my vision in this role at OPM, is to continue to push the work forward and have people make those connections. So I'm here to support in whatever, capacity.
Okay, great. Julie or Mary Beth, any ideas on kind of what you hope, what your mission or vision for this group is, what you hope to be able to accomplish?
I guess I'd like a little clarity. I know you were mentioning workforce development, but it was labeled sort of education and training. So what is, like, the people who created the subcommittee, what's kind of your vision of what our sort of purview would be?
Yeah, so I get the education and training to be able, so this started with, at least, and Tara, jump in if I'm on the wrong track, but my understanding was it started with a discussion around, what are some of the biggest obstacles to getting access to services for individuals and getting people off the wait list and all. And a lot of it has been the lack of available trained clinicians to be able to take on these folks. And if we hear the report from Caroline, you hear about, there's still pockets of the state where there's not adequate resources to care for individuals or provide service for individuals and work with families. So when I say workforce development, it's in terms of how do we build a pipeline through education and training to meet the needs of the workforce, if that makes sense?
Yeah, that's
Okay.
helpful. Thank you.
Okay.
I mean, I think for me, one thing that I sort of see is that there's this balance between quality and quantity, or quantity and quality, maybe is a better order to put it in, right? That we need more people to do the work, but I have seen that sort of the more we expand, the more sort of diffuse the quality of the training has gotten. So that's sort of a motivation for me is, I'm seeing so many, people in my practice now who are diagnosed with autism who don't even remotely have autism, and so like, how is that happening? How can we make sure that we're expanding the services we offer, but in a way that we're, reaching the right people, getting services for the right people, that kind of thing.
So really maintaining the integrity of the clinicians, providers, that sort of.
Exactly. Yeah.
Okay.
Again, I'm Mary Beth Miller with the Office of Early Childhood. So as our agency sounds, we work with children who are much younger. And so, I suppose, what I can offer, or I'm happy to help with anything really, but we do see that there's a lot of childcare providers who have children who may be on the spectrum and are not getting the services that they need. The providers are not equipped to handle some of the more challenging behaviors. So to the extent that, there's anything that, we can do in the early childhood arena as far as, services and education, I think that would be wonderful.
I'll piggyback off on that. I know that a lot of the conversations that I've had, as far as the education piece too, and training extends beyond childhood too into adulthood, where if you have people with autism who do have high level behavioral needs, finding providers who are willing to support, and again, a lot of times it's not that people don't necessarily have the tools or know what to do. Sometimes it's just that funding is an issue, or staffing is an issue, and that's important for me too, is to kind of look at, from an education and training piece, people who are going into the field of direct supporters, and how can we better support them, and again, it's like the lifespan, right? It's easier to address some of these things in childhood than, that continuum as they get older, it's a little more challenging. So, really giving people the right perspective, and how do we build that workforce so that, we can have qualified people who, know how to offer those supports and services.
It's interesting. Anecdotally, I was at a Connecticut Hospital Association board meeting yesterday, and I'm on the Behavioral Health Council for them, and we were talking about, and I think this all relates. So there were a lot of acute hospital folks, where I'm the only hospital that's not an acute hospital that's on the board, but they were talking about how many individuals with IDD and or other developmental disabilities and or autism end up in the ED from group homes, and how the acute care hospitals feel that they're there because the group homes are not adequately trained or staffed to be able to handle that level of behavior. And we all know, knowing autism, that being in the ER is one of the worst places for an individual with autism. And again, it's like this circular discussion, because what's the challenge is probably both lack of training, lack of support, numbers of people, and then also the actual compensation for those individuals to work in a really challenging environment like a group home. And they talked about, and I can attest to it, I see it with my son in a group home, you essentially get 18-year-olds, and you hope that they're good people and kind, and benefit from the training that families provide. And I'm fortunate that I think I've trained the group home, and we've become a good partnership. But that's really what, honestly, I think about that. And, I see these folks, and I'm like, I'm grateful for them. They have energy, they're 18, they seem nice, and we hope they get a little training. But I think that's what we're getting at, right? And I know in our situation with a very intense inpatient program, we started out, my vision was to have a higher more highly credentialed individual, hoping that one, you bring in somebody that's a little more maturity, a little more life experience, and somebody who's going to be a little more resilient in working with a population like this. So we started out by requiring a bachelor's degree in something human service related. And frankly, we had to abandon that. We still say preferred because we just weren't getting the people. And then, or you would get somebody with a bachelor's degree saying, you know, geez, $20 an hour or whatever it was at the time, you know, I have a degree. That's not enough. So it's to your point, Julie, what happens is if you just go for numbers, you end up having to lower your standards. Now we do our own training to make sure we really have formalized our training to make sure that we do invest in that there's a fundamental baseline understanding of how to, you know, treat the individuals they're working with. But, you know, I think that's a lot of what we're dealing with. So. Interesting.
I think the challenge too is like to make sure that the work is quality. There has to be not just like an initial training, but some ongoing oversight. Absolutely. And who's going to provide that? Like you need to have numbers of people to be able to provide that. So
yeah, no, absolutely. Any other?
One of the practices that, and part of this is, you know, just bringing my perspective, but one of the practices that we had in Pennsylvania with our clinical, we had a clinical team in for our autism waiver. And we put on, you know, monthly trainings. We did statewide, you know, trainings. We were, you know, out and about offering those services. I think that, you know, even if we could find a way through, you know, obviously it's going to be some volunteers, but we have a lot of people on the council and connections that, you know, doing something like, you know, a quick webinar, lunchtime webinar or something, you know, just to help get some additional information and training out there, I think would be, you know, valuable for, you know, direct supporters, you know, trying to target some information for them that's quick. And, you know, I know a lot of the providers look for that too, but, you know, I think that offering some perspectives and resources and finding ways to increase their knowledge on autism and expectations, I think would be valuable for direct supporters.
Julie, you might remember being at one of our council meetings where we talked about, I may be saying this wrong, but sort of a mandatory education for folks. And I think some of the providers on the council who had small agencies said that if they have to pay for their staff to go to these trainings, it's another burden for them when they're barely making it. Do you recall those discussions? So I think that's that's something that we would maybe want to flush out. That would be a good discussion. I think at a council meeting to better understand what if we had the resources available to provide the training, what would the barriers to that be, right? And if it is, I know here we have to pay our staff for all of the training. It's just a function of what we do. So if we make it mandatory, we pay for it. I think that's the way with most employers. So I think some employers will shy away from making it mandatory for fear that that's going to be an additional expense to them. But I think if we could solve some of those financial barriers, it would really, I think the willingness to get the education would absolutely be there.
And then, you know, as far as the other part is, you know, getting people into the workforce, it would be interesting to talk about, you know, to the community college network to see if, you know, kind of maybe what we could leverage there or where, you know, just getting their perspective on, you know, people coming into the workforce from that venue.
I know there's like say, for example, St. Joe's, who we work with, they have obviously have a BCBA program. And I don't know that they have I think it's a BCAA, so it's a BCBA, like associate kind of level. I think that would be interesting for us to sort of collect what are the existing credentials, and like, and, you know, at what levels could they be, in what settings could they be employed, right? There's also beneath that is a registered behavior tech position. And Julie, you might remember Dr. Molteni when he was on the council, when he was at St. Joe's, and he worked here with us. We actually required our staff to go through that 80-hour training to get that behavioral tech credential, so that at least we could assure that everybody had that fundamental minimum understanding in order to go forward. But you know, I think it'd be interesting just to see what's out there, and then in what settings should they be used, or do we think that they could be used?
And that's a proposed change too, is to recognize RBTs.
Okay. All right.
For Medicaid, for
Okay.
the reimbursement, to change the criteria to try to improve
Okay.
you know, the people available to go out and do, you know, the ABA supports and services. So if that goes through, that will be you know, finding resources for people to get that training would be really important. So if there's a path, you know, advertising that path would be a way that people can get in, you know, to doing that work.
80 hours is, I don't, and I'm not sure that that program was actually, you know, certified by anybody, but we have this course for it. I know, you know, similarly in healthcare with nurses' aides, there was so few training opportunities. Those classes were always full, and we were all competing for a small group of individuals. So we ended up starting our own training academy, which is not terribly unique, but for us it was unique because it was a big outlay of resources, and we have, you know, had to pay an instructor and all, but it really has made a significant difference. We have like a waiting list for months and months to get into our training. So, and then you can, of course, you know, you get to vet these people, and you get to see them if they're showing up for their, you know, training on time, and, you know, it's free. We don't charge them for it. We made it very attractive, but it, you know, I think that's something, if we could create more programs like that, that's a way of really, once you have a baseline program that's been vetted, then it's a great pipeline of individuals coming into the field. So, and going to the high schools, that is great.
Yeah. And I also think of parents too, in that, you know, having access to some of those trainings, I think is something
that's a great idea.
Is not as advertised in, you know, resources for them, you know, especially around ABA. I just think of how valuable that could be for people who are waiting for services and supports. And that, to me, from what I've heard, is an unmet need for families who are waiting for, you know, because I mean, really, if we're talking about a lot of behavioral techniques and just the positive behavior supports for families, you know, whether they get a diagnosis of autism or not, there's a reason why they're seeking that, you know, and you know, and pursuing that evaluation. And those, you know, positive behavior supports and services, if we're talking about, you know, that type of training, is valuable for anyone. It's going to work for any child, is not unique to autism. So, you know, Mary Beth, to your point in the beginning, as far as, you know, finding training opportunities for, you know, daycare workers or, you know, professionals in that field would be, you know, again, those are techniques you can use with your own children. They're techniques that are, you know, going to be beneficial for any parent to have and have a better understanding of whether it's autism or not. So I think that that's also an area that we could be looking into as well.
Yeah, as a parent of a child with autism, I would say absolutely, because there's a lot of, you know, you get, you know, my son's level 1. So, you know, we don't require the more intensive services, but then we're sort of left on our own at the same time. We don't have a wraparound service. We kind of figure it out as we go along. And that can be really hard. And you're right. Like, those positive behavioral services and techniques are good with any child. But when you're really struggling with, your own child, and you don't know where to go and you don't have any of those resources, it's lonely. It's hard. Yeah. And I would say, and I don't know if this is outside the purview of this group, but there's a serious lack of paraprofessionals to support children in the schools. And I think we really need a good pipeline, for those individuals to get into that work. And unfortunately, it's, as we all know, not well paid. It's really hard work. And people are just leaving and not coming in. So I know that, with my child, I was, we were moved from one school to another school because there weren't enough paras at one school to meet the needs of all the children. So we had to go to another school where there were going to be enough. So that's hard too. So
I think that our hardest part is going to be what can we do within the scope of this group?
Exactly. I mean,
there's so much need out
there's
there.
so much.
Yeah.
It's hard.
Right.
There's no other way to say other than, yeah, it's hard. It's just so much need in so many different areas.
No shortage of opportunity, right?
Yep.
Right. Good reframe, Lynn.
It's like when we did our feasibility study, this was in like 2010 before we entered into doing services. It's like, holy moly, where do we start? And we just had to, we entered in the outpatient arena, which I think was the right place because it was something that we could do in a more manageable way. But I think it's going to, once I just envision, what programs exist, where looking at some of the gaps and starting with early childhood and working our way up. And then, I think by prioritization, honestly, I don't know how else. Otherwise, I think, again, being on the council a long time, we get frustrated when we don't make progress. And I think sometimes it's just we have very high expectations of what we're going to do. And it's great to do that. But I think accomplishing something is important, and especially to keep us motivated. And whether it's just chunking it out and saying in the first, in this first year we're going to focus in this area and see what gains we make, and then move to another area. Would we like to have more appropriately trained psychologists? Absolutely. Psychiatrists? Absolutely. But then that's a multi-year project versus can we train paraprofessionals and RBTs and work with a lot of the high schools now have healthcare academies. We helped start one up a number of years ago with the other hospital in New Britain, and they're not, these kids coming out of high school are certainly not appropriate for all jobs, but you attract them early on, and they get bought in, and they start at a very entry-level position. And we've had people start as what we call a patient support aide and then go on to become an LPN, right? It's just, you got to get them hooked in. And so thinking about those are all pipelines, and those are individuals who could be, I don't know what the requirement for a paraprofessional is. If there's is it 21, Mary Beth, do you know by chance?
I'm not sure. Yeah.
But I think just understanding some of those things, because that, those are, if you talk about autism, a lot of younger folks, I mean, it's much more, much more mainstream right now, but I think they don't know about what could they do to possibly help in the field. And really, they could do a lot if they have the right commitment and personality and training.
Yep.
So.
And maybe that's an approach, Lynn, is, how can, as the council, how can we be a resource to connect high schools or community colleges or, to the field at large to say, this is a huge service, field of, there's a lot of different roles. And, we really need to build capacity across the lifespan and across the system, because 1 in 36 kids, there is a huge opportunity for a career. I mean, that's how I started my career, was, doing an internship and working one-on-one with a kid with autism when I was in college. And, you know, as that, and it was a flyer that was posted at my university, and and ended up being my lifelong path. So, my career anyway, you know, that, so I just think that, you know, finding, you know, as the council, even how can we maybe do better at connecting people, or, you know, finding those opportunities to speak to groups and say, you know, this is what we do, and just, you know, even educate high schoolers, or, you know, whoever, on, you know, the opportunity and the need for people who are interested in this career path. Whether it's LPN or behavioral, or, you know, paraprofessional, whatever it may be.
Great. So I'm not so sure how we're going to be as formal maybe as we had hoped to be, like goals. I don't think we're there yet, but I mean, I think we've kind of identified some different directions that we can, you know, potentially pursue. I mean, I would certainly commit to meeting monthly. I think anything less than that is not, we're not going to make a lot of progress on that. So
maybe our first step should be like some kind of figuring out what the priorities should be, where the greatest need is, but balanced also with like feasibility. Like what do we think we can actually accomplish? Like you were saying, Lynn, like training more psychologists, which is a minimum 5-year endeavor.
Yeah, exactly.
And also right. That's not, you know, not going to be something we get done quickly, but thinking about, which of these things we feel like we could take on and maybe make some meaningful change in a relatively short period of time.
Yeah. I think just identifying, you know, our first report out and conversation with the council is, you know, what talent do we have around the table? Like what resources do we have around the table that we could convene, and thinking about, I like the idea. I think, you know, lunch and learns, or whatever you call them, even virtual ones, people will, I think, connect to. And then, you know, even if we do them, when I say informally, I don't mean it literally that way, but maybe, you know, there's no credit attached to it or any of those things, but we're providing education, you know, much like we do with the police departments. We've done it for the science center, right? We're basically, you know, going out, and we have a training program that we can do. And then you can, I think, what do each of us have that we could share, and building off of that, right? It's a start, it's a jumping off point.
Yeah, and we have, I mean, I'm looking at, you know, as far as a feasibility aspect, it's, if we're leveraging the, you know, the talents and expertise of people that we have on the council, and, you know, and or their, you know, connections along the way, you know, we already have a platform, you know, virtually, you know, we have a licensed Zoom account that's specific for the council, that, you know, I have access to. So, you know, recording, and we have a website already for the council. So recording, you know, brief, lunch and learn, you know, that they wouldn't even have to attend in person. It's something that we could post on the website. There's capacity there to, for people to have access to that, outside of just, you know, you have to show up at this time.
That's a great idea. Yeah.
So that's why I was like, you know, as far as it's not going to cost us anything, as long as we have volunteers who are willing to show up and do the presentation. We already have a vehicle to, you know, house recordings, and, you know, a platform, you know, to record them on. So
it's interesting, because we just, as I mentioned, we work with the police, and they were just out here yesterday, and we've done a number of in-person trainings, but he said he would like us to record one that they could use for, you know, either on an ongoing basis, as we talked about, because it's not one and done. And then if somebody comes in maybe off cycle, that they can, just like we would do for our own orientation, sort of a net learning platform, right, for this. Yeah, I love that idea. I think that's doable, right? Even if in a, you know, when I talked about a group home, or you talk about paraprofessionals. It's something that they can do on, lunchtime. Keeping them to 20 to 30 minutes is probably, as Julie and as an educator, you would know a little bit more about that, but that's probably sort of a sweet spot, would you say?
I mean, I think even for parents too, and families looking at, even if we do like a, waiver 101, Connecticut waiver 101 training, looking at, what are some of the resources available, working with our other, agencies to report out. I mean, we have extensive representation from all of the agencies on this council too. So, having them report out and sharing that, and having a place where families can go to get some additional information, I think would be extremely valuable.
Yeah. I wonder what ASRC has. I have not been to their website, admittedly, in a very long time. And my days of doing all that work are long behind me. So, with my own son, who's now 28, but how, I wonder what they have so that we don't replicate it, but we look at enhancing or, just doing something different than what they have. That might be worth, and I could certainly take a look at that. Or even
Absolutely.
just,
we can reach out too. We can,
Lois is on the, I know she's, retired, so to speak, but she's still very hands-on. So yeah.
Yeah, I can reach out. I don't mind reaching out to them.
Okay, that would be great. I don't, because like I said, they may have some information already there, and then we can supplement it.
The other thing I'm thinking about is not just workforce development, but retention.
Yes,
we
absolutely.
already talked about the pay issue, right? That's a challenge with retention, but then like burnout, I think, is another thing to really be thinking about, and whether we can make that part of the trainings or strategies for managing burnout, or support systems in place where they have like a peer group to talk to when they just need to sort of like de-stress or whatever it is, but kind of for that to be maybe something we're thinking about as well.
Yeah, that's great. Other thoughts, Tara? Any next steps we're thinking about?
Yeah, no, I mean, I think that I think next steps too would be, how do we want to structure moving forward? If we're going to set up a monthly meeting, do we want to pick like a third Wednesday of the month, or do we want to have, go month by month? I'm happy to send out like a poll to get dates over the next couple months that may work for the majority of the group. So however you want to handle that, I'm happy to organize that.
Just personally, I think if we picked a date and a same cadence of the third Wednesday or whatever, at least it's once it's on the calendar, it's it doesn't move, as opposed to trying to find a spot is much more challenging for me.
So is there a day of week that typically works better for most? Since we're four here, we get to
yeah, that's right.
My
generally Thursdays are better for me, but
Wednesdays are good, Mary Beth.
Thursdays are usually better.
Okay, yeah.
But I can make
Thursday afternoons pretty booked up with meetings, but mornings depends if I'm in clinic or not. But if I'm not in clinic, then my mornings are usually pretty free, and that's totally an unpredictable schedule. So yeah. I might just have to miss some if we did it on a Thursday morning. Yeah.
How about you, Lynn?
Again, all day, every day, but I think if we kind of get a consensus and I can respond to some things, okay. Definitely, I would say it tends to be sort of actually 1 to 2 time is generally not quite as challenging as earlier in the day. And then I have a lot of sort of 4 and 5 meetings. So I think if we could maybe look at a 1 to 2, I don't have anything standing on Wednesday, or I do have something standing at 1 on Thursday, but I could, if I with notice, I can maybe move that around. It's an internal meeting.
Okay. Well, since we have some other people who couldn't make this meeting, maybe what I'll do is offer, the 1 to 2 on Wednesdays, and then look at a Thursday morning potentially. Did you have something standing on Thursday morning, Lynn?
No,
You,
not
okay.
Not I do early, but not like if we did sort of a 10, I would be okay.
So I'll put that to the group at large and see if kind of what works, and then I'll propose kind of a schedule and put it out there.
Sounds good.
All right, fantastic.
Thanks, everybody. It's a good start.
Yeah.
Yeah. Good conversation for sure.
Yeah, great. Nice to see you all.
You too.
Bye, everyone.
I'll be in touch, everyone.
Okay,
Great.
thank you.
All right,
Bye.
thanks. Bye.